Okay, so let's talk about acute otitis media. Acute otitis media is usually an infectious disease, usually caused by bacteria like strep pneumonia, non-typeable Haemophilus influenza. Those are the main infectious causes, the bacteria that cause it, but it can also be caused by a viral infection. And as the name suggests, it causes an acute infection of the medial ear. We have external, medial, and inner ear, so it causes infections of the medial ear. And here you can see an otoscopic view of the tympanic membrane of a patient with a acute otitis media. Now, look at this. This is a normal tympanic membrane. This is how it should looks. Very clean, very nice, with a light cone, with the malleus right here, very nice. But in acute otitis media, what happens is the tympanic membrane bulges, become much more erythematous. The cone beam of the light, here you can see it right over here, is displaced, and it's much more erythematous. This is the sign in otoscopy that we have a case of acute otitis media. Now, when we are talking about pediatrics, because it's mainly in pediatrics and peak in 1 year old, this is because the Eustachian tube is much more horizontal in children compared to adults, where it must much more vertical, so it's much easier for infection to cause otitis media in pediatrics, especially peak in 12 years old. So we have acute otitis media. Now, if the patient is quite okay, just a little bit of pain, but no high fever, no very severe pain, no complication, no neurological complications, we can watchful waiting for pediatrics for some days until 74 to 2 hours without antibiotics. If it doesn't get better or it gets worse, we'll start antibiotics, usually penicillins like amoxicillin, the drug of choice. Now, there may be complications like mastoiditis, even intracranial complications. So this very simple thing that usually gets resolved even without treatment can complicate and be very dangerous with mastoiditis and all the complications of this. So this is, in some words, in a nutshell, about acute otitis media. This can become chronic. Usually it doesn't, but it can become chronic. It can cause perforation with secretions, but those are the complications that might happen. Usually it resolves and everything okay. So thank you very much. This was in a nutshell about acute otitis media, and that's all.